You decide you want to do it, and then it's like you've spent, like Smita said, years thinking about it, not talking to anyone about it. And then someone finally listens and gets you, and you kind of show them what their results are going to be like. And they're like, yes, now let's do it. Sign me up. I'm signing my name, and we're doing it.
About labiaplasty without the shame or stigma. So there's a lot of conversation and hesitation about labiaplasty procedures, a lot of judgment. And we are here today on this episode of Lipstick and Lipo to tell you the real deal. We do these procedures in our office weekly, multiple a week, and we just love the transformation that our patients are seeing and really just how more confident they're feeling about this area. So this is a no judgment zone. We are breaking down labiaplasty on this episode of Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita. I've got Dr. Ashley Amalfi here, co-host. Talk about labiaplasties.
This is
Hi.
like this is your favorite topic, you guys. When we do labiaplasty, you guys listen, and we love it too. I dare say it might be one of my favorite procedures. I don't know if that's weird, but I just think it's pretty compelling, and people are so happy, and I'm so happy to do it.
Yeah. Well, I think what's so cool about this too is that most of our patients have spoken or they've thought about this for so long, right?
Yeah.
But like nobody's talking about their private areas. And when they finally get enough courage to talk to their OBGYN, for example, they're sort of brushed off, right? Because we have to remember it's all normal, right? No matter what that area looks like, it's normal.
Yeah.
Um, so it's really cool, at least when they come to see us or they've watched us on Instagram, on Lipstick and Lipo, seen our social media where we're talking about these procedures and they come in and they know that we can relate, we understand, and we're there to help.
Listen, we're
It
not
feels like
judging.
a check, right? Like you can almost see like the weight lifted off their shoulders as they're talking to us, like, oh, this is just like a normal thing for them. And it really is, which is why
And
I
they
think
want to
it's
do it like instantly. They're like, okay, I'm here. I feel comfortable. Like, let's do it tomorrow. And we love that
I
because
we had a patient last week. We just had a last minute cancellation and she got in the next day. Like
they're
she
like,
was eager to get it done.
labiaplasty is literally maybe labiaplasty and breast augments. It's like the highest turnover because, like, you decide you want to do it, and then it's like you've spent, like Smita said, years thinking about it, not talking to anyone about it, and then someone finally listens and gets you, and you kind of show them what their results are going to be like, and they're like, "Yes, now let's do it. Sign me up. I'm signing my name, and we're doing it." But let's talk about a little bit about just like what it is, because I think there's a lot of misinformation about what a labiaplasty really is and what the risks are. But what are most of your patients asking for?
So most of my patients are specifically talking about the labia minora, right? So that their inner lips, sometimes they overhang and they're more visible past the majora, which is where the hair bearing area. So a lot of my patients, they either feel like they feel discomfort. So if they're wearing yoga pants or they're spinning or they're wearing bathing suits and there's visibility, or they even just get the friction on their like some of them don't even wear jeans because the friction of the
It's
skin and rubbing
uncomfortable.
feel comfortable or it gets caught in your underwear. And so, everybody's reason for getting it is different. Some people just don't like the way that it looks,
Yeah,
and they
and
have
that's fine too.
things that that's 1,000% okay. But it's typically the minora where there's redundancy or extra skin there, it overhangs and there's more visibility.
And that's really how simple the surgery is too, you guys. Like, you guys have, usually you're coming to see us because the labia minora is really long, discolored, sometimes thickened. And really all this surgery does is trims away that extra long skin and tissue that you have there. It's really that simple. And it doesn't mean that you're abnormal. It's just like breasts. Breasts can be small, big, droopy, perky, and so can labia. But if you don't like it because you don't like the way it looks or feels or both, then you have the right to do something about it. As long as you guys are going to a board certified plastic surgeon who really knows this stuff, really knows the anatomy, can make sure that you're not going to have, you know, a disfiguring result or a nerve injury or something like that, that's where you want to go to someone who's really doing a lot of labiaplasty. And we both are doing a lot of labiaplasty and we love it. And so you want to make sure you find the right doctor. And when you do, you'll know. You'll
Right.
feel that like instant relief and understanding, and you'll be ready to go.
Yeah, absolutely. And I think, I'm sure you see a lot of revisions too, right? Or patients that have gotten procedures somewhere else.
Yeah.
And I think what I love about this procedure is, at least in our hands, because we do this so often. And I mean, truly, this is like part of our everyday, like every week, like surgery schedule,
Built
right?
into the schedule. Yep.
Yeah, like the risks and the complications in our hands are minuscule, right? Because we are doing safely. Less is more, just like everything in plastic surgery. And so if you're conservative and you understand the anatomy, we're not seeing the nerve injuries, we're not seeing the wound healing issues, we're not seeing these like
And
awkward, crazy like shapes and appearances. We're just seeing beautiful results that patients are really happy with. And you know what's really funny? This group are my labiaplasties, they're
yeah.
the ones that never follow up with me. I see them like initially and then they disappear because they're so like happy. And then, I like almost like force them to come back into the office because I want to see how everything is
I
going.
see them for a little bit and then I stop making them come back in because they're like done. They're like healed. And so they're my shortest follow up, not because I don't love them. I love them, but like they're done. They're fine. They heal super quickly. They're back to normal. They're obsessed with it and they don't need me. So I usually will like shorten my follow up with them, whereas surgical patients I'm seeing for the full year. But labiaplasty, few months, they're gone.
They're looking
And
the
that's
best.
fine because they're really fine. But yeah, I think it's really important that you're seeing the right doctor, a board certified plastic surgeon. I have a lot of patients who will sometimes ask their OBGYN to do it and they'll tell them, well, like I could technically do it, but it won't look really good. And, you don't want someone who's giving you like an ultimatum. You want someone who feels super confident that they can do this safely and that they can meet your needs. And that's why plastic surgeons have really kind of owned doing this for the last decade or so. And it's really growing in popularity because, it's a pretty effective, safe, and high patient satisfaction procedure. And you got to find us because we would love to do it. We love doing this.
Yeah. And it's so, and I think that's the thing, people are talking about it too, right? So
Thank God.
when
I
people
mean,
are talking
enough.
about it,
At least we're talking about it here. At least you're seeing it, on some TV shows. I wish more, but
wish more. I
we're getting
know.
there.
But yeah, and so, and that's what I also love is that people are more forthcoming about it. They're talking about it. They know that there's an option out there if this is something that bothers them. And that's what we're here for. This is what we do all the time. And we talk you through the whole process because it seems like the hardest part is getting into our office or even doing the procedure. But a lot of times it's just the recovery. Not because of pain, because of swelling, but we talk you through the whole thing. So you know what to expect and recover the best that you can. And like you said, Ash, like people don't come back after a while because they're
You're
just
good. Yeah.
happy.
We're happy. They're out in the
Mhm.
world, not thinking about your labia, and we're really happy for you.
And it's also what I love about this too is it's all age groups, right? I mean, I see really patients, I see patients after they've had a bunch of vaginal deliveries, and then even my older patients after menopause are coming in because their body is changing. So I think it's a pretty neat surgery and a really cool. We just love helping women. That's it. We're women. We love helping
We love it.
you guys. Yeah.
More labiaplasty topics to come because I know you guys love hearing about it. So if you have specific questions, we've done series on labiaplasty before, put them in the comments and we will keep addressing all of your concerns. You guys know exactly what you need to know about labiaplasty and how to find the right doctor. But make sure that you guys subscribe, like us, tell your friends. We're everywhere: Instagram, YouTube, Spotify, Apple, and anywhere else you want us to be. So we will see you guys next week. Bye, Smita.
Bye, guys. Bye, Ash.
Bye, hun.